Is acceptance and commitment therapy for SUDs. Before discussing about the therapy, I'll talk about the history of therapies. In first wave therapies, researchers mainly focused that the behavior depends on the conditioning. For that, they gave operant and the classical conditioning theories. In second wave therapies, the researchers stated that the cognitive processes are involved in the developing behavior and led to have cognitive behavioral therapies. But in third wave therapies, researchers focus that behavior is a result of interaction between internal and external environment and the experiences in the life of a person, through which acceptance and mindfulness based therapies came into force. Then the roots of ACT. The philosophy they focused, that is functional contextualism, science is contextual behavioral science, and technology is applied behavioral analysis. Theory they follow is relational framework theory. Application, the ultimate result is acceptance and commitment therapy. The next concept they talk about is psychological flexibility, in which they talk about the awareness and the person, how much they are able to take their decisions based on their values and the awareness of the situation, that is contacting the present moment fully as a conscious human being and based on what the situation affords, changing or persisting in behavior in the service of chosen values. In psychological flexible person, they adapt to fluctuating situational demands, they reconfigures the mental processes, this can able to shift the perspective according to another person's, and they are able to balance the desires, needs and life domains. Then the hexaflex of psychological flexibility and the psychological inflexibility. All those 6 components of psychological flexibility and psychological inflexibility will discuss in the coming slides. Then acceptance and commitment therapy. It is a form of contextual behavioral therapy, that is depending upon the context or the events of the person's life. It is about the taking action depending upon the values of the person, those values which really matters in a person's life. And it is a process based therapy, that is it involves taking history, acknowledging one's history and reactions as a guide in life, emphasizing the importance of embracing and processing painful experiences to achieve the wholeness and the freedom in the life. The aim of ACT is not to reduce the symptoms. First of all, its aim is to change the client's perspective towards their symptoms, that is changing the relationship with the symptoms, so that they will not be able to hold back from their valued living beings. That is, whatever circumstances will come, whatever sign and symptoms and bodily sensation thoughts will come, they will try to focus on the valued living, which will make their life rich, full and meaningful at the end of their life, so that as per the Rickson's theory, they will feel that they have achieved integrity and wisdom rather than despair. Ultimately, symptoms will reduce as a bonus. Previously, therapies were mainly focusing on the controlling, hiding and running, avoiding, fighting with signs and symptoms, thoughts, feeling, emotions, sensations, urges, cravings, images, impulses throughout the body, throughout in their mind. But in acceptance and commitment therapy, in contextual behavioral therapies, they focus on acceptance and committed towards their right values through the awareness via the mindfulness. These are the components of acceptance commitment therapy also, so we'll discuss in detail. First is the experiential avoidance. It is a component of psychological inflexibility. I will be discussing parallelly a component of psychological inflexibility and then the psychological flexibility. Mostly or normally, nobody wants to have negative thoughts, feelings, emotions, sadness, any kind of craving and bad impulses in their body. So what they will do, they try to avoid those emotions. They always seek the immediate pleasure by having drugs, by avoiding their responsibilities, by taking bad decisions, by indulging in wrong lifestyle that will lead to unsatisfactory life. But in acceptance means the willingness to take all those experiences, to feel those experiences fully and without defenses. That is, the person is able to embrace their good and bad, ups and downs, happy and sad, negative and positive of their life experiences, whatever happens throughout their life. That is acceptance. There is a quicksand phenomena, that is, whatever you will try, if you're stuck in a quicksand, if you will try very hard, you will shake around, you will land up more and more sink in the quicksand. You will not be able to come out of it. But once you will let go all those struggle and keep your body relaxed, calm, what will happen? Your body will be lose its struggle and able to float over the quicksand. That is same is with the life. If you will drop all the struggle with the thoughts that I will not drink today, I will fight my craving. No, nobody can do that. So letting the client express what they feel, what kind of thoughts they have when they are having craving, that will help them understanding that they're struggling with it, rather than they should be letting it go. They should drop the struggle with the pain and they should stop fighting and avoiding the suffering. The same metaphor is available on the YouTube also, passenger on the bus. You people can check it out. Next, we can help the patients that what is under their control and what is out of their control, what can they do and what they can't do. What they can do, they can control their actions, they can focus on their present moment, they can focus on goals, efforts, healthy lifestyle and their own language. But what is not in their control, their thoughts, feelings, emotions, sensation, their past, future, results, diseases, language, thinking, opinions and actions of others, those things they cannot control. For that, they need to accept that whatever is out of my control, I will not focus on those things, and whatever is my control, I will focus and work upon all those things only. We must have heard about all those myths that people say if someone is not happy, they are not alright. To have a good life, one must not have negative thoughts or feelings. You must not be able to control. You must be able to control what you think and feel. What is this? Those are dialects by the people. Whatever they are saying, the person start inculcating in themselves. That is a cognitive fusion, that they start attaching themselves to the words and their meanings. That is, their thoughts become their reality. Those myths become the reality. They become very important and truth. Until unless they'll not be happy, they'll not be having good life. But rather than having all those things in their mind, person should believe that this is all going to persist. Take example, if I'll say don't think about a white elephant, take 5 seconds, I'll count 1 2 3, nobody have to think about the white elephant. 4 and 5. Is it possible for anybody to control their thinking? That can they control that they are not able to think about the white elephant? At least once they will have an image of white elephant, at least for a fraction of seconds. It happens, we attach ourselves with those thoughts and meanings. And the emo Philip said, I used to think that my mind was most wonderful organ. Then I realized which organ was telling me that how mind is playing with ourselves. We really need to diffuse ourselves with that. For that, we person should have ability to separate themselves from those thoughts. They should be able to notice what they are thinking, what the thoughts are coming, and thoughts are coming, I am able to notice that thoughts are coming and let them come and go instead of caught in them and allowing them to dictate what the person can do. For the cognitive diffusion, person can think that the same way we can see the changes in our body, the same way we can see the thoughts in our mind through the mindfulness, in which we notice that this kind of thought is arising in my mind, that I have a thought that I want to drink. That kind of thought is here and will go away after some time. The same way we are able to see our body mirror, the same way we are able to imagine and see our mind through the mindfulness. The leaves on stream metaphor says that on a stream, the way leaves are going, the same way in the arena of our mind, those thoughts are coming. If we'll try to stop 1, 2, 3, 4, 5 leaves, what will happen? The leaves will start accumulating, and one time we have to let go. In the same way, if we'll try to stop one thought at a time, what will happen? We have to let go those thoughts, otherwise they will take away us with themselves and the person will be relapse. How to diffuse and respond to thoughts? Person can ask, is it my own urge to drink alcohol or use drugs, or just influence of some external factors? Is it important for me to drink or use substance? Is drink alcohol or abusing drugs helpful to me in current situation? Is it right for me to drink alcohol or abuse drugs? For that, they can give name to their mind, in which they can talk to their mind as if they are talking to somebody else by answering those thoughts. Third component is difficulty in contacting present moment, in which the person start thinking about the past or future, how pleasurable even things were when they were drinking and abusing substance. They were so amazing moments. They keep on ruminating in that moment. What will happen? That automatic pilot phenomena through which the patient will get relapsed, and in this we can educate the patient about the lapse and relapse, sign and symptoms, and the stages of relapse. In the third component of psychological flexibility, this contact with the present moment, that having awareness of present moment via mindfulness. What is mindfulness? That is, we are able to understand what is happening around us, what is happening inside our body, what all are the sensations people have in their body. Mindfulness is a mode of attention which is composed of acceptance and an increased ability to respond to the current moment. It strives to focus on present moment. By being mindful, we attain a clearer understanding that how our emotions, our thoughts impact our physical as well as psychological functions. Mindfulness can be carried out in day-to-day activities such as eating, listening songs, walking. One mindfulness activity we can plan, that is sober breathing or sober breathing during craving. That is, first we'll teach the client to stop whenever they have some kind of negative thought that they want to drink. I just want to drink right now. The person has to stop for a while. They have to observe what just happened prior to this thought and what somebody has influenced it, or is it my own thought, is it required or not. After diffusing ourselves, then they will breathe or do some mindfulness breathing for a while. Then they will expand their perspective, that is, what is right for me, what is wrong for me, what is happening inside my body, what is happening inside my mind, what drove me here, that I am thinking about it, but what I should not do. Then they should respond as per the values they have set for themselves. There are many techniques and mindfulness techniques, that is mindfulness body scan, mindfulness seeing, walking, listening, reading, writing and eating. Then the person whosoever has attached the meaning to themselves, they see as a conceptualized self, that they are not able to take perspective of somebody else. They see themselves based on the judgment, thoughts and feelings, sensation, roles and memories. Like one of my patients stated that I am alcoholic and I am very irresponsible partner and father. I am very bad person. I don't believe I can quit alcohol. What it caused? It caused a boundary, that they have a difficulty in controlling those urges, and led to constructed or inflexible mindset, which led to relapse. But on the other hand, the person will think that as self as context, that observing as the observing themselves and experiencing their inner and outer world, and also distinct from your thoughts, feelings, physical sensation and roles, just like a bookshelf. In the bookshelf, whatever content is placed, that is not going to determine or not going to define the bookshelf. It will remain just the way it is. You are not your thoughts and feelings, rather than you are the context or arena in which they unfold. The same way on the sky, so many weathers change, so many things, thunderstorm, rain, sunny days, clouds comes and go, but ultimately what happens? Sky will remain blue only. The same way a life of a person, like mind of a person remain same after all the experiences, negative, positive and all the ups and downs of life. That arena is remain same. Fifth component is the values, that is helping our client to understand and reminding them what they want really from their life, what is important and what makes their life so meaningful them. If they'll be at the age of 80s or 90s, what will make their life meaningful, what will make them happy and satisfactory at the end of life, so that they will be achieved the wisdom and integrity at the end of life. Values are the one's deepest desire if they want to pursue their personal and professional life. Those are the values. These are the following some of the values which we can give our patients and help them to categorize, or in ascending order, place them in ascending order, what is most important to what is least important, so that they will be able to manage their committed actions towards their values. Committed actions, they are just the goals in which they will achieve their values. If how we are going to set those values, that is, if a person wants to be a good father, a responsible father, we'll ask the father that what all things will make you responsible. That is giving the time to their children, helping the children in their homework, making them participate in extracurricular activities, taking them on outings. Will make a checklist and will help that at least one task you have to perform daily, so that he'll be able to perform 2-3 tasks, or maybe all the tasks at the some time, that is 2-3 months. And throughout that, will teach our patients that they will try something new and innovative, and being therapist will help the patient in having planning all those some good activities and innovative activities for to achieve those values and making their life happy, not happy and meaningful. And ultimately, I want to end this session that life is not about to get rid of the problems, then start living. Life is going on now, and as a professional, I believe that patients with this kind of mental illness, substance use disorder, and it's our ultimate responsibility to help our patients to make their life satisfactory and worthwhile, so that they will be able to fulfill their roles as community member. Thank you all.